All right, Billy Cunningham, the Great American Red Space Park kicks off in about 15 minutes live from Wrigley Field, where fans are falling from the stands and being killed, but that's a different story. Hopefully the Reds can win out of 3 in Chicago. They need to win at least one game. Now, about 5 or 6 years ago, I had on Dr. Gary Kirsh of the Urology Group, perhaps the eminent experts in the field of urology and certainly prostate medicine in the tri-state. And there was a federal government recommendation that we men at some point quit getting PSA tests being done. And that was somewhat controversial at the time. I understand that the government may be changing its collective minds. A man with perspective on this is that same Dr. Gary Kirsh of the Urology Group, who walks in the shoes of Alan Cordell. Gary Kirsh, welcome again to the Bill Cunningham Show. Doctor, how are you?
Well, sir, how are you today?
Good. First of all, what about my old friend Alan Cordell? What's he doing these days, if anything?
Well, he's playing a lot of golf and enjoying his retirement.
Why have you considered the same approach?
No, unlike Dr. Cordell and Mr. Cunningham, I can't afford it.
All right, let's talk about what happened 5 years ago. I can vaguely recall you coming on the big one with me. And the government advisory panel recommended against routine prostate screening for men. That was 5 years ago. What's happened since, if anything?
Well, a lot of things have happened since. First of all, when they made that recommendation, we knew it was a disaster, and it was done by one of the most insulated and least accountable agencies in the government. Well, since then, Bill, the incidence of aggressive prostate cancer and prostate cancer that is spreading has increased.
Uh-oh.
And now the same government agency, under pressure from a bill we've introduced in Congress to open up their proceedings, has reversed their recommendation 5 years later after men have gotten sick because of it.
So if someone paid attention to the federal government in 2012 and said, well, the feds have said routine prostate screening isn't always necessary for men, if someone had paid attention to that, there may be thousands and thousands of men who got sick and died.
Well, I don't know the exact number, but there's no question that many people did pay attention to the recommendation, including not to their fault, a lot of primary care physicians. And there's no question that men have been harmed. And we specifically warned very, very vocally against this. It was obvious to all urologists that it was a boneheaded move by the task force.
In fact, I can recall you saying, I have you on once or twice a year, but I can recall you saying 5 years ago, don't pay attention to that.
Correct.
Well, now, is that legit? As a urologist, can you say no to the federal government?
Well, right now we can say no to them because even though they put that ruling out because of enough public outcry, they did not enforce reimbursement, although they have the power to do so. They have the power to tell Medicare not to pay for the PSA test. Even though they recommended it, they never cut off reimbursement for it.
And this is another reason not to have single-payer system. If going ahead 20 years from now, long after since you're retired, people are so sick and tired of all the political games played in Washington, and we go to a single-payer health care system, and the federal government bureaucrats make all decisions about all health care all the time and hire all the doctors in the country to become government employees. And then a future government says, we're not going to pay for that, then that really has teeth.
That is absolutely correct. And, I don't want to overly politicize this issue, but I can tell you as a person who treats patients and who interacts with the federal government on the behalf of doctors and patients, it is very difficult to deal with the federal government about day-to-day health care decisions, and you do not want a single-payer system.
All right, let's talk about where, in the last 5 years, can you talk about the metamorphosis, the changing aspects of men's health and prostate care, just what's happened the past 5 years?
Well, lots of things have happened in the last 5 years in men's health and prostate care. We've got a lot more people getting treated for advanced prostate cancer when it has spread with more advanced therapies that are helping extend their lives. At the same time, on the early diagnosis side, for those who did not ignore the PSA test over the last 5 years, we have many more diagnostic tests available that help us determine if a man needs a prostate biopsy or not. We're doing a lot more prostate MRIs rather than just going right to biopsy. And even if a man has a very slow-growing, almost inconsequential prostate cancer, we now have up to about a third of the men being watched who have prostate cancer. So much has changed. We are not as aggressive with biopsying because we can get people out of it more easily. We're not as aggressive with treatment. But we still have to screen because there's still many men who get serious prostate cancer and can have their lives saved. It's still the number 2 cause of cancer death in men, Bill.
One of my golfing buddies had a PSA that went from 3 to 4 to 5 to 6.4 over about a 3. It's not one of your patients, by the way. He doesn't go to Urology Group, Dr. Kirsh. And
how's that possible?
I don't know. I don't know, but there are other docs in the tri-state, but not as good as the Urology Group, but that's a different issue. So he's talking to me up and down the ladder. What do you think? And I said, well, you know, my PSA right now is 3.2, and I'm screened once a year, and it's been in the same range for a long time. What's your doc telling him? And when it got to 6.4, his doc told him they needed a biopsy. And my buddy told me that's the most painful thing I've ever gone through. They went through my rectum wall into my prostate. They did like 5 areas, and it came back negative for cancer. And I said, well, what are you going to, you know, he's 67 years old. I said, what are you going to do now? He said, well, I'm going to keep monitoring it. Why would a PSA go up 2, 3, 4, 5, up to 6.4 over a 3-year period if it wasn't cancer?
Well, this is one of the reasons the PSA gets criticized. It's not a perfect test, but at the same time, it's not a worthless test. It can go up just because the prostate is growing in a man that age in a benign way. However, I wouldn't criticize that, doctor. That PSA went up substantially. The risk of cancer statistically for that man was probably about 25% when he underwent that biopsy. Now, at the same time, as I mentioned a couple minutes ago, we now have new tests that can help that man avoid a biopsy if we get additional information that says that that PSA of 6 is not as worrisome as it might appear.
At what point, if you're a guy in your 40s living in Mason, Ohio, and say your family's got a little bit of history of prostate cancer, I think it was the age 50 or 55 in the good old days, back when men were men. At what point now, if your family has some prostate cancer, should a guy begin to be screened?
If you have a history of prostate cancer in your family or African American men, I really think the screening age is dropping down to 45, if not lower, because those are the people that we want to catch. We know there are genetic mutations, and we now know that the same families who have a high prevalence of breast cancer in their female relatives are at risk for aggressive prostate cancer. And we're starting to look at that issue as well. So if there's a strong family history, not only of prostate cancer, but breast and other cancers, then men should be screened earlier.
Dr. Gary Kirsh of the Urology Group, why do black guys have a higher risk for prostate cancer than white guys?
Well, I don't know if anyone knows the exact reason. It's a genetic thing. I mean, in different populations, people are more subject or at risk for different conditions. Some people more risk of diabetes, some people more risk of hypertension, and on and on. Somehow, evolutionarily, in the African American population, there is a higher penetrance of gene mutations that lead to prostate cancer, but the exact reason that happened, I don't know.
At what point do you not get screened? Another one of my older friends, he's probably 70, I don't know, 73, 74. He says, I'm not going to do it anymore because what the hell? I don't have it now, and I'll die of something else. At what age do you say enough's enough?
Well, I think that you shouldn't look at it strictly at an age. You should look at it based on the person's health and vigor. If the gentleman is 73 years old, in very good health, and expects everything else being equal that he's going to live to be 85, he should be screened because the death rate from prostate cancer is higher than any other cancer in older men. It's actually him we want to catch. If he has a low, slow-growing, low-grade prostate cancer, we're going to leave him alone. But if he has an aggressive prostate cancer, he may die of it at the age of 85, and that's not a pretty experience.
Now, lastly, shouldn't men have a serious discussion with their women about making sure they have regular sex so that their prostate fluids are moving on a regular basis?
Well, Bill, I think such a discussion is always advisable, but I cannot endorse it on a medical basis, but I can endorse it on a social basis.
So medically, isn't it better to get the fluids moving?
I don't know that there's a lot of evidence for that, but if it helps you convince your partner, go for it.
I like that. Dr. Gary Kirsh, we'll take that as a positive. President of the Urology Group. The takeaway is don't pay attention to the feds in 2012. Get screened. It's one of those preventable cancers. And Gary Kirsh, may you and the Reds this afternoon have a great afternoon.
Thank you, sir.